into a space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Rednam.
Welcome to the Confidence Doc podcast. I'm Dr. Rednam. I'm a board-certified plastic surgeon in the Houston area with my Houston surgeons. Today, we have a special guest, and I mean a special guest because this is someone I've gotten to know over a long building process, and I learned so much from him. So welcome, Frank Marquez.
Well, thank you. I appreciate the opportunity. This is probably a once-in-a-lifetime thing for me, but I couldn't have thought to do it with anyone else but you.
So
Frank,
Frank, why don't you tell our listeners what exactly it is that you do?
Sure. As she mentioned, my name is Frank Marquez, and I'm with a principal at THR3E Design. We are a healthcare-focused architectural firm that focuses on interiors and exteriors. We had the privilege of working with Dr. Rednam to do this wonderful space, this magnificent space that you practice and do your magic in.
That's right. He's actually right now recording in the space he helped create.
I never thought I'd be sitting in the space recording, but here we are.
So, Frank, I don't think a lot of people realize that there are different types of architecture, and that when you're in the medical space, that there's actually unique things that you have to think about. How did you find yourself in this space?
So what's funny is we both got someone in common, my spouse, right? You know, she's a patient of yours as well. And what's been interesting is she's a healthcare professional as well, a registered nurse and an ICU nurse. And, you know, for the longest time I avoided healthcare because I just wasn't my cup of tea. I was going to be a big designer and change the world that way. And one day I was introduced to healthcare, and I thought that was very intriguing. What I've learned over the course of my 30-year career is it doesn't oscillate. You know, healthcare continues to happen. It continues to evolve. New technology, new procedures, as you know, enhance the space. And so about 30 years ago, a firm gave me an opportunity to be in healthcare, and I enjoyed it. And I realized that, you know, I couldn't be in the theater room with you doing your magic, but I could design the space that you performed it. And so it was just as rewarding for me as it is for you. And so that's how I got in it. And it was funny because the first time I had an opportunity to do this, Suzanne goes, hey, you ought to get into healthcare. And I'm like, it's not for me. But here it is 30 years later. It's been very
she was
rewarding.
right, basically.
I hate to admit she was right. And it's funny because, you know, she was in the world, you know, Texas Medical Center, and right in the hustle and bustle of things. And I've now had the privilege of doing some spaces there. You know, multiple places here, and I've done spaces all over the country. So it's been kind of unique, you know.
Kind of going back a little bit, what type of education, what kind of school do you have to do to become an architect?
Yeah, no, that's a great question. So there's multiple processes to go through. You know, there's a 4-year program with a 2-year master's. Mine's a 5-year degree. There is probably 5 accredited schools in the state of Texas. And the school that I went to at the time was a 5-year program, which was a professional degree that enabled you to license. You know, now the programs that you see, for instance, at A&M and several other programs is a 4 and 2, which you get a 4-year undergrad in environmental design, and then you move into a specialization. And so healthcare is something that's just now becoming prominent in schools in terms of the education process of it. So the university I went to was Texas Tech University, and they have a healthcare certificate as well as Texas A&M, and they're really the only 2 schools in the state of Texas with that healthcare certificate. And so I think many kids want to grow out and be residential architects, and I don't know why it is or why we think that's the space we need to be in. And I think we're now trying to enhance that space and say, hey, look at other things. Healthcare is just as important, if not more significant than some of these other spaces, right? I want to be a museum architect. Well, that's great, but how many museums are getting built across the country?
Yeah, that's true.
Right? Whereas healthcare, it's one of the few businesses that does not oscillate, and it's very steady and it's consistent. And so if you're looking for a job that you can keep for a long time, that to me is a wonderful endeavor. And so I happen to sit on the board at Texas Tech on the College of Architecture board, and I enjoy trying to promote that. And I'm glad that our program is still there and that we're one of the few programs in Texas that promotes healthcare, because I think it's something that's significant and important.
So when you first started out, you were in a different job than you are currently. So what was that process like before you opened your own, basically?
Yeah, no, it's been a journey. When I came out of school, I was working for a small firm that specialized in government work. And so we were documenting judges' chambers and courtrooms and that kind of stuff for the GSA. I quickly realized that space wasn't for me. And then I moved into retail, learned a little bit about the retail side of things. And then after that is when I got into healthcare. And, and I spent, 20 years doing that and, 18 years at another previous firm before joining and starting 3E Design. And really I cut my teeth on the owner side as well, because prior to joining that firm, I worked for Texas Children's Hospital. And I was in their facilities department. So I got to see how a lot of decisions were made. I got to see the funding mechanism, how projects were funded. I got to see the whole delivery process. Got to see how board decisions were made and how people were hired or fired.
Yeah.
And so it was very intriguing to me, and it was exciting. And then I went to go work for another practice here in town, another firm here in town. And we've done, during that time, we did significant work for every healthcare system in town. And so that's kind of really where I cut my teeth. And then 5 years ago in 2019, we started 3E Design. And, and it's been a slow journey to get back into healthcare. But now we're working for MD Anderson, we're working for Memorial Hermann, we're working for Houston Methodist. And so every major institution in town we've worked for, we're working nationally for the VA. And so it's just taken a little bit longer, but it's been well worth it, and I think because of opportunities with you, not only to do the big building, the facade, but to also do your space has really opened up significant doors for us in the health space. So thank you for doing that.
Well, thank you.
Thank you for taking the chance on us.
Our space is amazing. For those of you who haven't had a chance to see it, we're talking about our space out in the Woodlands. And it really is. It's unique. I feel like we've actually had people come and visit and say, gosh, I want to recreate this where I'm at. So we feel very, very lucky to have this space. So let's say we have a lot of listeners who are physicians in different parts of the country. If they were interested and they wanted to build out, they're ready to go hang a shingle, they want to build their own space, what's the first steps that they have to start considering when they are joining with someone like with your firm? Yeah,
that's wonderful. I mean, I think the first thing is you got to identify the space you want to be, the region, the location. Once that's defined, then we can work with you to develop a program in terms of your needs and your specialization. Because it could be a licensed facility or it doesn't have to be a licensed facility. And so we need to understand those parameters and understand the budgets and the limitations that we have collectively to work with. And I think what you'll see is once that is established, then it's time to get out the square footage and start laying out the spaces and understanding the adjacencies to all your spaces and how you flow and how you work. As you recall, I was having the conversation earlier about I was sending napkin sketches to you.
Yeah.
And remember I was traveling and we were trying to solidify your procedure area and we weren't completely satisfied with the way it was laid out. And I was screenshotting and texting them to you and you were sending them back about, what about and I look back in that experience and I thought, that's crazy that I was texting you at 9 o'clock at night.
I know. I was sitting on my couch and we were texting each other.
I was on the way to the airport and we were, throwing ideas back and forth. And then when we got back, we were able to get that space the way you wanted it and understand, and it took a little bit of understanding from a perspective of how you're going to use it. And then all the ancillary stuff that we need to be considerate of, for instance, how does the supplies and materials flow in? How do your patients come in and discharge? How do your physicians and staff come in so that they're off stage and they're not seen every time you walk by and someone wants to talk to you, And so there was a lot of moving parts there that we had to work through to kind of consolidate that.
And I think a lot of our patients, it's not necessarily something they may notice that the space is beautiful, but I don't think that I certainly don't think about that now. I do after having done this build out with you. But when you walk through, everything has been designed so that the patient feels really comfortable, that they're not seeing all the stuff we're doing in the back. We put a lot of thought and effort, even in the operating room. When you build an operating room, you have to think about where's the clean room, where's the dirty room. We don't want sterile things going through a dirty area. And so there was I think there was so many back and forth because it made me realize, gosh, I didn't even think about these things, and we have to think about them to really utilize our space well, because we had plenty of space, but you have to have it organized well.
Well, and that's the whole thing. I think the biggest part is you got to have a vision, right? And I think, my hat's off to you, because you're one of the few people that trusted us and said, hey, let's think through this. And there was times that we challenged each other a little bit in terms of why we thought something should be a certain way. And there was times that you stood on it and drew the line in the sand. And there was times that you trusted what we were telling you and why we were telling you to do that.
Yeah.
And I think that collaboration, is something that's very significant. And I think the success of projects are a direct correlation of that collaboration between not only your physicians, but your staff, as well as your architectural team. Because, anybody can make any space look pretty, but it has to function first and foremost, or else we've all failed, right? Not only us delivering the project, but you from a workflow perspective every day that you got to be in that space. And if you remember, we completely redesigned that whole area because we didn't think it was, we didn't think it was right and needed to improve. And I think you let us do that. And I think a lot of times, trust the people that know what they're doing and let them do that, guide you. And I think, my hat's off to you that you did that with us, because that was significant. And I think the outcome is incredible. I think you're happy with it. I think your patient's experience is incredible walking through the significant pods that we did and the whole process. And, and the materials coming in, never coming into your suite.
Yeah.
And so those can happen at any time, and your patients don't even know that they're supplying your facility. And so those kinds of things are very significant in the design process. But there's got to be some shared collaboration. There's got to be some trust. And I think those are the things that I think a lot of times people are afraid to relinquish. Because, hey, I'm a physician. I've done it this way. This is the way it is, right?
It's not unlike what I have my patients do, right? They got to trust me on a certain level. Obviously, it's like different materials. But at the end of the day, it's that trust me that you come to me because I'm an expert in it. So trust me to deliver the best results.
Right. And I'm not going to go in there and say, hey, here's how I'd like to look, or here's what you need to do to make me look like that. I'm going to say, this is you. Tell me what it looks like. And I think that's a big part, and I think sometimes a lot of the baggage that comes with the design of this type of facility is that you've worked and had your training in facilities that may not be appropriate. And you're like, well, I remember when we saw this and I really liked that, or I didn't like that.
Yeah.
And a lot of times it's like, hey, let's start from scratch and let's see what we can come up with that's yours and whole and can be holistic to the entire process.
And I think too that at least my generation and older generations, hospitals were really just meant for utility. There wasn't much beauty in them.
Absolutely.
And I think now hospitals are being built more for yes, there's utility, but people want them to be aesthetically pleasing too.
Sure.
And so I think that there's certainly plenty of office spaces that are just there because that's what you have. But our goal was for all of our patients, whether they're reconstructive or cosmetic, to really feel like they're getting this really unique, beautiful experience. And so I think that we knocked it out of the park with that.
Absolutely.
So let's talk a little bit about teams. So you're part of the team that helps create stuff. Who are all the other players on the team to make a space look like our space?
Yeah, no, so absolutely. So the architecture team helps on the planning, on the documentation, and the design of the physical space. But you also need a mechanical engineer to help with the air distribution, especially in the procedure suites where you want to have so many air changes per minute. You want to have the low returns to exhaust everything out. You got to make sure you have all the gases and everything that you need to do your magic, right? The electrical engineers required as well so that we can circuit emergency power. We have a generator outside that services your suite.
Which we definitely need with an operating room.
Absolutely, and so, all those isolation panels and all that stuff is done by the electrical engineer. The other thing is, we need to have a plumbing engineer as well. And what they do is, all the stuff associated with your disinfectors and all your sterilizers and everything that we have to clean your equipment, that RO system that we have, and all those things are part of the design that is required to be able to have a clean environment. And so those are really the primary ones. Then as we move forward with technology, you want a low voltage consultant that'll help us with some nurse call. You want a low voltage consultant that'll help us with wireless access and the different power data that you need for your computing, your computing needs. And so those are really the team that you need. Obviously it was a unique deal here because we had already designed the building and we were just a tenant within the building. So the box had already been done, for lack of a better term. But when you do an entire new building, you'll need a structural engineer. You'll need a civil engineer to help with the site, and then you'll need a landscape engineer. And the biggest thing, and we're going through that now next door, is a significant thing is a geotech engineer, which is a soils engineer that will tell you what your bearing pressures are for your building. And as you know, next door we're putting a LINAC, and the bearing pressures on that, because it's all concrete, is going to be significant. And so having those components in place, I think, is important, and so those are the players that kind of decide this.
And I think it's interesting, right? I think, like I said, the average person, you put a building up, you design it and things like that. But there is an insane number of really smart people who are involved to make sure that everything goes well, that you're building on a sound structure, and that you're building for it to be durable, right? We're not looking for short term, we're looking for something that's going to last for a long time.
Right. Well, and I think the biggest mistakes that consumers make is they'll go hire an architect who thinks that he knows healthcare and he's practicing and learning on your facility, right? And a lot of times it's unfortunate because it's fee-based, and the fee-based between a healthcare architect and a non there's quite a bit of difference. It's no different than, a quality plastic surgeon and someone that's not.
Yeah.
Right? I mean, the fees are substantially different. And so a lot of times, physicians will say, hey, we'll take this guy and take our shot with that guy. And it creates problems long term. And I think a lot of the healthcare systems have recognized that, hey, if you're not a healthcare architect, you're probably not going to be working on any of our spaces. And so I think that's the biggest lesson learned, because I've seen it in the market where physicians come up and say, I'd like for you to do, an ambulatory surgery center for us, or whatever it may be that they're wanting to do. And they're looking for the bottom price. And I'm thinking, I would, I always laugh because I always tell people and say, hey, you'll never take your Mercedes to a Chevy dealership. It just doesn't make sense to do that.
Yeah.
And so I think when you start hiring a healthcare architect, you need to really take that into consideration and not necessarily let the fees dictate your selection, because at the end of the day, you're the one making the investment.
Yeah.
And I think it could be costly if it's the wrong one, especially if you got the state involved, right?
Yeah.
When you bring in the state for certification and everything.
All these permits, things, yeah.
Exactly. So it creates some challenges there. And I think that's the biggest obstacle I see when physicians call and say, hey, we'd like to do the following.
Yeah.
You're like, so who's my competitor? And, and they'll list 3 or 4 architects. And I'm like, we're out, because they're not healthcare people. And, and I'm not going to be held to that standard, because we take pride in what we do.
Well, and I think, like I said, I can't help but keep drawing parallels. It's very much the same in my space, is that you don't want, certainly you always want to be cost conscious, but at the end of the day, you shouldn't let that be the only thing that you pick on, because there's a lot of credentials and reasons why people are more expensive.
Right.
When we did the project, I think that a lot of what I learned too is that I didn't even realize how much of our day is kind of like the flow. I didn't think about it. We just do it, but it was really important when figuring out where to build what. We really had to sit and think about how do we move through the day, and how do we make things efficient, especially in a group like ours where we have a lot of doctors. How are we all going to work at the same time and not be falling over each other, basically?
Well, and I think we achieved all that because the way we segmented and the way it's laid out, I don't know that there's a whole lot of overlap unless I've missed it.
Yeah, no, I think that things have gone great so far. Do you remember probably what might be the most unique thing that you helped us build?
Yeah, probably it'd probably be the breast implant.
I figured.
Yeah, no, the breast implant cabinet, right? And I think what was interesting to me about that was, it was going to be a showpiece. You
Yeah.
know, and I remember you telling me I got 150 of these or whatever the number of implants, and it was very significant. And so, we had to show them in a certain way. And I think to this day, one of the photos that we have and that we use when we market your space is that. Because I think
it's a cool picture.
It just turned out very good. But I think, a lot of that had to do with you, and I think you don't end up taking enough credit because, you pushed us and we pushed back, and I think the end results was phenomenal. I mean, because here's the deal. I always tell people, bad design doesn't cost you any less than good design.
Yeah.
And so why not try to achieve good design every time, right?
Yeah.
Your waiting areas, they're unbelievable. And so, but you trusted us with finishes. We did some things that I was like, wow, she's letting us do that. That's cool, right? Because a lot of people don't. And I think the overall appearance of the space, the synergy that exists, you can take a lot of the credit. Yeah, we kind of helped you put your vision there, but it was your vision that got us there.
Well, thank you.
And so that's something that I think, a good healthcare firm that collaborates with a physician and a good physician with great vision and great, and understand this, one of the challenging things that we have when we design spaces is our mind is that, oh, you should be able to see it like we do. Right. And it's like your sculpture, when you see a patient and they're like, hey, I need the following work done. They see it one way and you see it a whole different other way, right? And it's trying to find and align expectations that you're trying to do, and that's no different than what we're trying to do when we're trying to develop your space.
Yeah.
Right, because your expectations are X, and we're trying to get that data from you so that we can deliver it, and that to me is the fun part of what we do.
Yeah.
And I always laugh because I was like, I wasn't smart enough to go to med school, but guess what? I'm smart enough to do their theaters for them to do their magic.
Yeah.
Right? And so that to me is just as exciting.
No, you have to love what you do, right? And I will tell you that implant wall is a hit. Like, no one can stop by it without peeking in and looking. And so I think you helped bring exactly what I was kind of hoping to achieve. We still got to fill it up with more implants, but it does look beautiful.
No, it does.
Where do you see the future of the healthcare space going? Because you're involved with a lot of big projects now, and we've kind of established that it is a very unique space. So where do you see the future?
Well, long term, the goal is to reduce the average length of stay because of insurance coverage, right? And so how do you do that? And I think you touched on it earlier, was the hospitality piece of healthcare, right? And I think as we get older and folks get older, we got to improve on that, right? Because insurance companies and people aren't paying what they used to pay for healthcare. And so you got to figure out how to be lean, how to deliver the healthcare and deliver the quality sooner than later. Obviously technology, with AI and everything going, and it seems to be the buzzword. What'll be interesting is what impact does that have in healthcare, right? And I think at the end of the day, it's about the data. Who's managing that data to make sure it's the most accurate data and the best data for us to use that artificial intelligence, right? And so that's the interesting part of where this is going. And I'm curious to see where it goes.
Yeah. Do you see AI in any way encroaching on your design space?
It is, and it's interesting because right now it's a very interesting time because you can use software that exists for design, and obviously you got to have the data to back it up, but you can start populating it. It can spit out 100 different solutions, right?
Yeah.
We did a little sample project for a project we were chasing, and we were just giving it the parameters of what it was, size of it, the height, the materials, the number of spaces, and it would spit out 20 different options right away.
Yeah.
And then you could go out of the 20, pick the things you liked, and it spit out another 20. And so, what worries me about that is the human tactile piece of it, right? You and I were flipping back information over our phone that was getting hand sketched, and you were doodling on it, sending it back. A lot of that intimacy is going to go away because of AI, because of that type of technology. Now, with that said, you have to embrace it because if you don't, it leaves you behind.
Yeah.
And you become a dinosaur, right? And same with you, right? I think that's going to happen. What's interesting is the equipment, it's quicker. MRIs are quicker, CTs are quicker. All that technology that's improving, and it's smaller. And so I think those are the kinds of things that I look forward to seeing as part of the next generation of healthcare.
I agree. I think there's like a good app. I think there's gonna be interesting applications for it. It's just, and if you don't embrace it, yeah, you'll get left behind for sure. I think that I can see potentially that there being more outpatient surgery centers being built as things become maybe like certain things will always be hospital based, but I can see where more and more of these kind of standalones are becoming more the norm as more things are becoming outpatient that we traditionally always thought were inpatient.
Well, what's interesting is there's a lot of big organizations that just focus on, MOBs and ambulatory surgery centers, right?
Yeah.
And they're all over the country developing them. And so it's interesting when you see a physician wanting to go out there and do it and get their practice out and doing it. And so, I know you took a leap of faith and partnered up and with the developer and, created this beautiful building and this beautiful space. And so, investing in yourself is sometimes the part that's difficult.
Yeah. Well, it's scary. It's a big investment, both financially and emotionally. Like, you're putting a lot out there. But I think that at the end of the day, like you said, the way that we thought it through as a group was, well, medical's always going to be here. You know?
Well, and the other point you just said, you just touched on it that was interesting. When I started the company in 19, I ended up betting on myself, and it's no different than your practice, right? And so when I decided to leave my previous firm and do this new thing, I'm like, where's the risk? It's me. I got to bet on myself. And, same with you when you started your practice, right? And I think those are the kinds of things that I think, in my opinion, make a difference and change the trajectory of whatever that is. Because, what I look at leaving my old firm to where we're at and the trajectory and what we're doing is totally night and day. And, but it was because I took the risk. And I always laugh because I tell people, is it really that big of a risk? You just call your former employer, they'll hire you back. If you're good, they'll hire you back.
Yeah, if you're
right?
good.
And when I decided to make my move, I thought I was good. And so I was like, worst case scenario, I'll call my employer, they'll hire me back.
Yeah.
So where's the risk?
Yeah.
And so I think those are the kinds of things. But what's going to be interesting is you put these out there, individual folks put these out there, you're competing against big machines. How do you set yourself aside? And I will tell you, I'm a big fan of brand recognition, right? And I think you go anywhere in Houston and your brand's everywhere, right? Because I think you're one of the few people that understand the branding aspect of it. Yeah, so you're a great surgeon, but what else are you? Well, you better know marketing. And, we were having this conversation earlier with your team about, hey, she's a unicorn because you're different. You're not just a physician. You know all the other stuff that you have to do to be successful as a physician.
Well,
and that's
thanks.
important.
I'll tell you honestly, like I think it was one of the coolest things being able to be involved with building the space is just that it was just like expanded my knowledge base so much because before I just walked in a building and I'm like, it's a cool building. But now I'm like, I sit there and I'll like see something and be like, oh, I have to start thinking about it more just because I have more knowledge about it. So it's actually pretty neat. It's been really neat for me.
Well, but you're one of the few people that actually was hands-on. Most times you're like, hey, just deal with my assistant. And then when there's a problem, hey, well, how did we get here?
Yeah.
We had issues all the way along the process. I mean, nothing significant, but there was things that would come up that we had to address. And, and the one thing I will applaud you for is that you were accessible. No matter what time, even if I texted you in the morning.
I'm a 24/7 kind of person.
Well, yeah, you have to be, right? When you're invested in something that you're doing, you have to be.
Yeah.
You can't just turn the switch on and off. And so, I might not get a text from him until midnight, but we were communicating that way. And I think the ultimate success of the space, yeah, we had the vision together, but I think how we solved some of the situations and minor hiccups, those are things that happen collaboratively, and there was never, hey, well, how are you going to fix it? It was always, hey, what are you thinking we're going to do? Or it was always a very collaborative we spirit. And in our industry, that is very finite in terms of it's right or it's wrong. You didn't have that. Your line was blurred. You were like, hey, we got an issue. What are we going to do to fix it? And so I think those are the kinds of things that make successful spaces and great stories, right? To the point that you're one of my judges at my cook-off, right? I mean, you're a wonderful,
I've eaten a lot of barbecue.
Wonderful client, and an even better judge, right? And so those are the kinds of things that I think that I still like about the intimacy of what we do. And hopefully AI doesn't take that completely away.
I agree. I always, with anyone I work with, I like getting to build these relationships.
Sure.
I think that that's one of the unique things about when you you own a business, that you can create and make all these different relationships with different people. So I think that one of the real unique reasons I wanted to have you on here is I wanted our listeners who are, like I said, they're mixed of physicians, patients, things like that, to really know what goes into building a space. Yes, there are plenty of doctors who just rent a space and that's what they're doing, and that's fine. But there are a lot of doctors, and specifically, I will tell you, plastic surgeons, our space is a big part of who we are. And so that's why when we designed it, we want you to feel we want you to have a feeling, we want you to have that Disney feel. You come in and you're like, wow, this place is amazing, because that's what we think about our work and we want to project that. So for my patients or future patients listening, it put a lot into it and got such an amazing team to help with it, because it was that important to me that our space really projected who we are as a group. And so thank you so much for coming on, Frank. It was really an interesting process, and I feel like I keep learning more and more about things as we go along.
So when are we building the next one? or when are we doing your house?
Give us a few years.
No,
I thought you don't do residential.
I don't do residential. It was a joke. Because, naturally, it's the next extension. You got to go build your house.
You got to go build a house.
That's funny.
I think I'm going to take a little break from building stuff for the moment, but who knows the next 3 to 5 years what comes up, right?
We hope to be here for you when you decide to do it. And like I said, it's been a privilege. I think our friendship has grown as a result of working together. And I think your space is probably one of the nicest spaces in Houston, Texas.
I would disagree.
And I'm being biased because we did it and we were part of it together. Yeah. And you trusted us with your vision. And I hope we got it right, because it's a unique experience.
So, Frank, if somebody listening is really interested and they might want you to help them with their space, how would they find you?
Well, you can reach us on 3design.com, or you could look at LinkedIn. We have a page there. We have an Instagram page as well, and so.
I forgot to ask you, how did you come up with 3 Design?
Well, it's simple. I came from a firm that had 2 names on the door, and I've always thought that our profession is about creativity, and it just seems like it's always about our egos. And so one of the pet peeves I always had was, architects are supposed to be creative space thinkers or creative people, and yet they put their names on the door. Not only is that so uncreative and such an ego thing, but it also creates a problem for future succession plans. Because, when Frank decides to leave, and whenever that is, why do I want to burden the next generations of partners with my name on the door and everyone having to ask him, hey, is Frank still involved?
Yeah.
And so when we were doing this, it happened on a trip to New Orleans, and it happened after I'd resigned from my previous firm. We were taking my youngest to the Manning Academy down in Louisiana, and so my bride and I were going to spend the weekend in New Orleans and just figure out what it was that we were going to do. And she was more nervous than I was because I already had the plan. But what I wanted to make sure was that we came up with something creative. And so 3 Design is just a very simple elevator pitch that it's your faith, it's your family, and then it's your occupation in that kind of order. And they all got to balance each other. They can't be one over the other.
Yeah.
There's a certain hierarchy that exists. And so, and there was a lot of other things that, I left the third quarter of 19, the square root of 9 is 3. I had 3 kids, my bride's birthday is April 3rd and mine's March 23rd. So there was a lot of 3s that were circling around. And, it has a lot of biblical terms and meanings there. And so that was kind of the high level. And but at the end of the day, it was like, when I leave, I don't want to leave any burden for the next generation of leaders. Perfect example is your organization. Your names are not on the door.
Yeah.
There's plenty of plastic surgeons that got to have they're monument to themselves, just like architects.
Yeah.
Without thinking of succession plans down the road, and that was important to me because I wanted the next generation of leaders not to have what I decided, and the other part was I wanted them to build something, and if it wasn't what we had built, to build it their own way after I was gone. And so that was the reason 3 Design came about.
Well, I love that. I love that explanation, and I really like the basically like within those 3, like that really is like really for life should be like that as well.
Yeah,
So.
if you look, what's interesting, if you go to our website, there is a napkin, the original napkin. Again, it's digitally made, but I have the original napkin in my office, and whenever we get on Teams call, you can see it behind me. But but it has all the symbolism with all the 3s on the napkin.
Yeah,
and it happened at a little bar in New Orleans on Bourbon Street.
Yeah.
As we were sitting there one afternoon just enjoying some sodas, and I just started doodling on this napkin.
Yeah.
And to this day, if you go to our website, there's a cocktail, the story, and the napkin on the website.
that's like
that
a
shows
that's
it.
like a movie finish.
It is a little
like,
movie.
It's
Yeah.
like a little movie.
Yeah, and so anyways, but yeah, so I still got the original napkin.
Well, awesome. Well, thank you again for joining us. I hope our listeners enjoy this. It's a little different than our usual content, but like I said, there is so much more that goes into building a place and having like a really not just a beautiful but functional medical space. And so hopefully you all know now that there are these special people like the people at 3 Design and Frank who help us create that so that we can provide the best care for our patients.
Absolutely.
So thank you for joining us on the Confidence Doc, and stay tuned for our next exciting episode.
As we wrap up another episode of the Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.